As the highly contagious Omicron subvariant spreads throughout the U.S., new COVID-19 cases are on the rise in most states, including Indiana. 2 years into the pandemic, some may not know exactly what to do after testing positive. How long should you isolate these days? What therapies are now available? Mandy Gaither has more on what health experts are recommending.
An Omicron offshoot, now the dominant strain of coronavirus nationwide.
In areas where community levels are high, everyone should be using prevention measures and wearing a mask in public indoor settings.
If you do test positive, whether at home or after a PCR test, experts say isolate immediately. At home, go to a room away from others. If the result comes at work, put on a high-quality mask like an N95 in public places until you get home. How long should you isolate? At least 5 days. Day 1 is 24 hours after a positive test or appearance of symptoms. That means not being in the same room with others, not going into work, and wearing a well-fitting mask while in common areas. Open the windows as much as possible. After the 5th day, the CDC says if you have no fever and symptoms are improving, you can go into public places with a well-fitting mask. But some schools and workplaces may have their own policies. The CDC says an infected person should still wear a mask around others, even at home, through day 10. After a positive test, talk to your doctor. See if you're eligible for therapeutics, all meant to be taken before someone gets severely sick. There are antiviral pills which can be taken at home. There are also 2 types of injections or infusions for those at higher risk. The sooner you start them, the more effective they'll be. For Health Minute, I'm Mandy Gaither.
If you don't have a regular doctor, you have options, including going to a test to treat facility where you can get tested, see an urgent care provider, and get therapies all at the same place.